Hey everyone, shout out to everybody in the chat. All right, let me see who's here. Hopefully you guys can hear me. Can you guys hear me? Let me know. Let me get this little thing off my head. This right on top of my head. Here it is. Okay. Shout out to everybody that's coming in. Let me salute my beautiful members. I know I have, who do I have in the house? Peekaboo, welcome. SW, thank you. Who else? Who else? Who else? Grandma, welcome. Grandma Brienne, Lux, Lux, welcome. Thank you, thank you. Hold up, y'all. Give me one sec. Excuse me. Stacy, welcome. Thank you. Hey, Chico, how are you, my love? Amy, Natalie, excuse me. I always could say Natalia, excuse me, but it's Natalie. Thank you. No E. Natalie. Tammy, welcome. Bunny, how are you? Wim, Karma, welcome, welcome. Bowling, welcome. Ooh, everybody's like, I want to know what the toxicology. Well, we're gonna talk about that. Darcy, welcome. Flor, welcome. Who else? Hey, blank screen. Mom of Gladiator, how are you, my love? Welcome, welcome. I hope you guys are having a great morning. Yes, Flor, welcome. Everybody, all my beautiful members. T, Marie, Sakina, welcome. D-Lane, welcome. Thank you for being a member. Flor in the house as well. Kitten Claus, welcome. There was a comment here, and I wasn't really sure what it was referencing to, but I was trying to look for it. I get distracted sometimes, you guys. You know how I have severe ADHD and I get so distracted. Hey, Tammy, welcome. And anybody else that I did not greet, welcome everybody. Please hit that like button while you're coming in. Natalia, you got me on the E. I've been saying that my whole life. I got points up. Are you serious? So it's Natalia? Because of so I was like, I don't want to, I just want to make sure I say it correctly. All right. Thank you. Hey, Squidward. Thank you for, well, I appreciate that you guys are here. I've got words just like same, LOL. I want to know if there was a DNA test done. I haven't watched any coverage on this one, waiting on Rev. Oh, thank you, Mom of Gladiator. Welcome, welcome. Well, shout out to you. Okay. Natalie, no A or E. So it's just Natalie. Just no A or E. Thank you, Natalie. Thank you, thank you, thank you. All right. Have you had your morning coffee yet? No. I've had my Red Bull. I'm having it right now. It's probably not a good thing to drink. Yes. Yep. Came in with receipts and birth certificate. Lord have mercy. Look at you. Thank you. Thank you. Much love to you, my love. All right, we're gonna hit the ground running. So there is a TikToker.
And I'm going to put her information in the description box. We did talk about this TikToker before because I remember in a couple streams ago, she had talked about how the school was sending emails to students about being quiet. Okay. So those that don't know about this case and what's been going on. All right. So let me give you a little bit of a short summary of it. January of 27, Alexee Trevizo goes to the hospital with her mom. Okay. This is a hospital that is, I want to say it was like a local community hospital. It does not have like a OBGYN center to it. All right. They give her, she's complaining about back pain, severe back pain. They're giving her tests about pregnancy. Lexi's saying she's not pregnant. Mom is denying she's not pregnant because she's getting her periods. Everything's fine, right? She's not pregnant. She's not pregnant. So then doctor decides to give her like a urine test for pregnancy. The urine test comes back positive. Doctor believes, tells her, well, I think you're having like a miscarriage or something. For those that have had miscarriages before, like typically a urine test doesn't suffice. If the urine test is positive, you're having severe back pain. It needs to follow up with blood work to make to read your HCG levels. For those that have had, like myself, we've had miscarriages before. We understand ectopics or miscarriages. We understand how important it is to get medical follow up because you want to understand where this pregnancy, if it's viable, where it's at. It could be in the tubes. It could be ectopic. It could be what's the other one? There's other words, medical words for it. And excuse me, I'm not a medical professional, but it's a huge emergency. So yes. So what happened was she has to go to the bathroom. The test is positive for. She has a positive pregnancy test. She has to go to the bathroom. She goes to the bathroom. She's there for about 20 minutes. Um, and people are checking in. Mom is going to the hallway twice. Medical staff are walking in there. They're hearing a lot of flushing. They're hearing a lot of noises in there, but nothing to open up the door. They get to the time where she's been there 20 minutes and they're checking on her. They get to the time where they're wanting to open the door, and right when they're going to open the door, I guess she opens the door and she walks out of there. They're noticing that her socks are covered in blood, so she's got a trail of blood walking from the bathroom all the way to the emergency room, her room that she's assigned to it, right? And cleaning crew is coming in there. They're noticing a huge mess in this bathroom, right? As it was described. There's no pictures or anything yet. We know that the pictures were taken, but no pictures have been posted of what was left of this bathroom. Okay. So, cleaning person is in there. There were concerns by the medical staff that she was possibly having a miscarriage and flushing things down there. Of course, that's what they were saying. They're going in there and they're, checking the room and everything. Cleaning stuff is like, oh my God, cleaning stuff. And then she picks up the trash bin and notices the trash can, excuse me, and notices that is which is covered. There's a liner on top of this, a clean liner on top of this trash can. um, and she's like, this is pretty heavy, right? This is a heavy liner. She takes she starts kind of messing in there and she realizes that there's I guess you could see through the liner, there's a baby in there at the bottom. Medical staff are called in. The head nurse in charge is called in. The head nurse in charge, and now this is a very key detail, which was something that he misinformed the detectives on when he had the interview back in April. So all of these medical staff, cleaning crew, are having these interviews in April when the incident happened in January, right? So the head nurse charge says, I immediately took to the baby to trauma room 2, which we saw the video. We know that that did not happen. The nurse head in charge goes in there, runs all the way back to where Lexi's room is at, where the doctor's at, pulls the doctor out and says, you got to come in here ASAP, right? And then they all run back to that bathroom and essentially take the baby's still in this bin. Take the bin down to this wherever they took it to, and Lexi's still in this waiting room, right? Law and Crime released the body cam footage, some of it, not all of it. It was like, I want to say under 20 minutes of body cam footage of Lexi being confronted, talked about, and with the police officer, as well as the doctor and everybody. They tell mom that there's a baby in the trash can, and that, essentially Lexi put this baby in the trash can. Mom is having kind of a fit. She says something, "I told you about this," and they kind of go back and forth. They have this little riffraff. Another creator by the name of True Crime Anayeli, which I heavily promoted, excuse me, on my channel. She put out the complete full body cam. I suggest that you guys go out there and check her channel out. Give her a sub and a like, okay? From the police. Okay, so we understand from the day after when the detective is trying to get a hold of mom and Lexi to interview them, she put the body cam footage of when Lexi is arrested. Okay, all of it is out there, right? A lot of TikTokers were talking, and this is one as well. And you guys, I'm going to give her information out in the description box. This TikToker is, I think it's Abby Lynn. This is Abby Lynn. And Abby Lynn had a TikTok live, or not a live, but an upload yesterday, where she essentially released the autopsy report. She released it. We're going to review that autopsy report today, but I'm going to play this in full so you guys can all see it and know exactly where to go to review the whole thing. I got screenshots of the autopsy report, all right, and we'll go from there. Let me go ahead and play this.
Hey everyone. So a lot of people have been asking me about the autopsy report, and I do have a copy of it. I've debated posting it or not, but I finally decided, you know what, I'm going to show it. So here you go. Okay, so this thing is 7 pages long. I'm going to go through them pretty quick. Just start screenshotting and go back and read them later. Here's one. Page 2. Look at that.
We'll slow it down.
Entrapment, homicide. It's chilling, you guys. Here's page 4. Page 5. 6. And page 7. Now, when you go back and read it, you will notice that it says phentermine was found in the baby's system, and that is an appetite suppressant that was obviously passed to him through Alexee. It's also known as a diet pill. Now, what's really interesting to me about this is that she claims that she did not know she was pregnant. She didn't understand the weight gain. She was going to come off the birth control and start taking diet pills. So the fact that diet pills were found in the baby, it corroborates that story. And then, of course, the morphine got passed to the baby, which, I mean, she got that when she was in labor in the ER, so that's to be expected. And then everything else in that autopsy report pretty much says that the baby was normal, full term, completely viable, everything that you would expect. You guys, I honestly don't know what to make of this regarding the diet pills, because that corroborates her story that she didn't know she was pregnant. I'm really at a loss right now. What are your thoughts? Because I'm just spinning.
Ooh-wee. Hold up, y'all. Where did that TikTok, here it is. Okay, we're gonna go back a little bit. Hold up.
Hey, everyone.
All right, we will go through that report here in a minute. I've got where it says, actually, I think I found the video where they carry the trash. Yes, they do. They do carry the trash can in the hall surveillance, unless I'm wrong. No, you're right about that. What I'm saying is that the charge nurse went to go meet with the CNA and the house cleaning about the liner. They still left the baby in there. Then he went to the room, okay? Went to the room to get the doctor, and then after that, that's when they grabbed the liner and went across the hall with the line, or with the trash can. But thank you so much for the $4.99. The only thing that confirms is that she was restricting her weight in an attempt to hide her pregnancy, no doubt. Ooh, I think this 19-year-old knew she was going through. Yeah, I mean, it's a lot. It's a lot. Thank you. I've got words. Yes, it's on the hospital surveillance camera. Yes, that is correct. It is there. Yes. Yes. All right. Let me see. No. Yeah. No. I'm glad I clarified. I didn't want anybody to think. So what I'm saying is, this is the crazy part. When these medical staff, they waited, what, 4 or 5 months before interviewing these medical staff, okay? This event took January 27th. Of course, accounts are going to be different, but we don't know what they were consulted with in terms of their risk management, hospitals, like what exactly were they were told to say, or what, you know what I'm saying? Like that piece, right? So what the surveillance shows is completely different than what the head nurse in charge is saying. So that's another thing. Thank you, man. It's either he forgot or he lied or something else. Yes, took the trash can in the hall, left it there. Then the doctor took it to the room. Thank you. Opened the liner on the table. It's the doctor's interview. She says she opened it and put everything on the table. Right. So head nurse in charge didn't think of opening the liner. Head nurse in charge didn't think of, like, what if the baby is still breathing? Because if you listen to the housekeeping interview, she says that the bag was like right to the baby's face. The baby could have been, the baby was born alive. Okay. So that's why I was like, yeah, it's called CYA all day, every day, right? Mm-hmm. Mm-hmm. Mm-mm-mm. Yes, yes. All right. All right. So, yeah, he didn't even say he tried to resuscitate the baby. The doctor said, when it's there, they have to make a decision. This is a doctor. She said, when there's possibility of life being saved, of course. But the doctor said the baby was already gone. That's what the doctor said. Okay, keep that in mind. Okay, let's look into this report. I did screenshot it. Okay. I got a couple of shots. Let's see. And then you guys can, let me see. And I also got a couple, I did it in a video, and then I also got a couple of screenshots. So I'm gonna try to pull those so we can zoom into them. So the whole report is about 7 pages. Okay. The actual narrative starts on page 2. Let me see. We can get this going. Hold up, y'all. Here it is. Stop screen. Here we go. This is page 2 right here. Okay. So I will read. I will do my best to zoom in and read. This is why I was like, let me make sure I'm able to. These are screenshots, yo. Keep that in mind. These are screenshots. Okay. So we find final pathologic diagnosis: entrapment. 1. Found tied in a plastic trash bag. Adrenal hemorrhage. That's B. And C. No injury. Number 2, live born male newborn. A. Aerated lungs. B. Air in stomach. C. No decomposition, or is it maceration? Maceration. All my beautiful, wonderful medical professionals, what the hell is a maceration? Can y'all put that in the chat, please? Educate me on this. Let me know, what is a maceration. All right. And then 3, because these are numbered. Sorry, y'all. There's obviously a lot of information redacted there. It says, redaction: without injuries or congenial abnormalities. A is redacted. B, what is it? Patent fomen, ovale, and ductus areotis. All of that is medical jargon for me. Thank you. Maceration is skin breakdown. Thank you, Amy. Thank you, thank you. He was alive. Laceration is when your skin is wet, turns white and wrinkly like a tub, like in the tub too long. Thank you. Look at this. I love my chat. I got so many professionals in here. Let me see if any other comments come up. And let me put this other device in as well, because I don't want to miss y'all comments. Let's see. Grace to skin. Thank you. Hold up. Maceration, follow the grain. Thank you. Is the chemical removal, dissolving of muscle and other tissue in specimen while leaving, okay, big words right there. Sorry, y'all. Parts of it are needing for identification. Adrenal hemorrhage are caused by trauma like a car accident, probably from baby hitting the ground. Oh my goodness. Gotcha. If you pull the Band-Aid off your skin, is wrinkly and pale. It's macerated. I love that. Okay. I think the doctor and the charge nurse both could have used better choices with their words. Umbilical cord and other words in that jargon. Thank you, Zoots. Thank you, thank you, thank you, thank you. All right. Let me scroll down a little bit more. And again, I am zooming in. So the narrative reads, and if I skip a word, please don't charge it to my, some of this is medical stuff. I'm not well versed in this. But if you guys know what that means, please educate me in the chat. Narrative summary and opinion. Baby John Doe was blank baby boy who died. Huge redaction there. Cleaning staff, redaction, were cleaning up in the blood, were cleaning up the blood in the restroom when they removed the trash bag from the trash can. They found the baby in a second, I think, trash bag. The word is cut off, by the way, under the first, at the bottom of the trash can with bloody paper towels. The trash bag he was found in was tied. Hold up, y'all. Closed when it was found. Redaction. Was notified of the found baby. Okay, let me go back and read that. I feel like now that I've cleaned it up, it would make a little bit more sense. Cleaning staff, blank, were cleaning up the blood in the restroom. When they removed the trash bag from the trash can, they found the baby in a second trash bag under the first at the bottom of the trash can with bloody paper towels. The trash bag he was found in was tied close when it was found. Redaction. Was notified of the baby found. Another redaction. Death was pronounced. No resuscitation was attempted. When questioned about the incident, the mother reported, and then the blogger, the TikToker has her face over that. The mother reported something, and I think it says baby, was not crying or breathing. So she put it in the trash bag. Redaction. It is thought that the placenta may have been flushed down the toilet. Yeah. Oh my goodness. Okay. Let me see where everybody's at. Okay. Autopsy and postmortem computed, what is it? Is it tonography? Uh, Tomography showed an infant male without anatomic abnormalities. Anatomic abnormalities. Autopsy and postmortem computed tomography, is that how you say, y'all? Showed an infant male without any anatomic abnormalities, physical injuries. The lungs were aerated and there was air in the stomach and no changes of decomposition. The connections in the heart, okay, that allowed proper blood flow in the utero were still open, which not unusual. The adrenal glands showed microscopic hemorrhage, which can be seen. Lack of air. Hypnoxia, is that how you say that? Let me know. Postmortem viral testing showed no viruses. Postmortem bacterial cultures showed no growth in the heart, blood, or left lung. The right lung, oh Jesus, something fluid showed rare growth of likely contaminated bacteria, giving lack of inflammation in the lungs and brain. Postmortem electrolyte testing showed no abnormalities. A metabolic screen was, and it's hearted, I can't see that, was something for underlying metabolic disorders. A chromosome analysis was attempted, but was inadequate for interpretation. Post-mortem, I'm guessing that's what the word is there. Toxicology shows, isn't that the diet drug, phetamine, deprived of animaphine, I think that's how you say that, that is often used as an appetite suppressant, and morphine and opioid narcotic, and these medications are consistent with maternal consumption and placenta something. All right, I effed up that whole paragraph. Y'all, I have no idea. Okay. Any medical professionals up here? Okay. Did any of that make sense? Because clearly we need somebody to thank you. So that's a CT scan. Thank you, Graveyard Flowers. So tonography, excuse me, it's a CT scan. Thank you. I don't think she delivered the placenta yet, but the paragraph said that they think that she flushed it down the toilet. Not a professional, but that is bad. I forgot what state. This happened in New Mexico. I'm going to drop the link for any of my beautiful medical professionals that want to come up and tell me, explain that to me. What the hell is all that? What is that? I don't understand it. The baby was alive and healthy, no abnormalities to indicate this child's life, hold up, would survive, and was suffocated in the bag. The baby breathed and he was alive. Yes. That's much bleeding to me. She didn't mean. The placenta was probably in pieces. They never found the placenta. The baby was certainly born alive, breathing. She smothered him with the trash bags. Lord have mercy. The baby's name, they named the baby Alex. You can have pain meds giving birth, folks. It's 2023. Okay. Let's keep reviewing. I don't believe it was, that's a good question. I don't think so. Did the hospital do this autopsy? I don't think they did, because I mean, if they didn't even have an OBGYN or labor and delivery, I don't think they did. That does confirm, Nanya has been following this, that does confirm that they gave mom morphine before she went in the bathroom. Can morphine allow her to feel no pain? That's a hard one. Yeah, Jules. Shout out to Jules. Girl, they named they did. They named the baby. Well, if you watch that the body cam footage the day after, mom asked the officer, "Are we able to take?" Like, she did ask to take the baby. They do have like a little memorial, little candlelit area in their home for it. They named the baby after, well, mom's name is Alexee. The baby's name, they named the baby Alex. They did. So that depends how much morphine they had. Okay, let's keep going, y'all. Let's keep going, okay? And again, excuse my lack of medical readiness here. A neuropathology examination showed a normal for age brain without any pathologic findings. There was nonspecific vascular congestion, which can be in hypoxia, among other things. I don't know how the hell I said hypoxia, but I said hypoxia. Pretty sure that's how you say it. The air in the lungs and stomach and no evidence of decomposition is consistent with the baby having been born alive. Whoa, 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 whoa. Oh, excuse me. Let me read that again. The air in the lungs and stomach and no evidence of decomposition is consistent with the baby having been born alive. Did y'all hear that? Did you guys hear that? Did y'all hear that sentence right there? Everybody, did that sentence make sense? The air in the lungs and stomach, no evidence of decomposition is consistent with the baby having having been born alive based on length, weight, and organ size, which is termed and compatible, I think the word is with, life outside of the utero. Entrapment occurs the uterus, outside of the uterus, excuse me. Entrapment occurs when an individual is in an airtight or relatively airtight container, in this case, a tied plastic trash bag. A blade, like the word is cut off, consumes all of the available oxygen until there's no longer enough oxygen to sustain life. Given the investigative information and the examination findings, the cause and manner of death are best, and that's covered, certified. I think that's what it says. Okay, let me go and this is page 2 of 7. Let me go find right quick 2 of 3, 2 of 7, or excuse me, 3 of 7. Lord have mercy, all my pictures are all crazy. Here it is. This is 3 of 7. Hey, love.
Hey, babe. Hey,
How are you?
Jay. Hey, everyone.
Lord
I
have
ain't no
mercy.
doctor, but I got this to say. Her stanky ass mammy, they both need to be sitting in jail. I'm sorry that we could have saved that baby. We could have saved that child.
Yeah.
You were at the right place. All you had to do was give birth and hand the baby over. Son, you was at the right damn place. And I don't know if she was scared of her mama or scared of the reaction from her mama is what maybe pushed her to go. Regardless, she was in the right place, baby. All you had to do was hand that baby over.
And be done. Between the medical staff and her, I just don't
And
know.
that's another thing. I'm sorry, but the medical staff needs to be held accountable too. Because if y'all sat here and said y'all had to bang on the door to get her to come out, then y'all seen the bloody footprints, but nobody never thought to go check behind her.
Exactly. She saw her socks. Did you see the surveillance? The doctor's looking at her socks like, you got all this
Nobody.
blood. Yeah, you're right. It never registered.
Common sense, I get it. I know because my sister's one. She's smart as shit, but she ain't got it. She no comment whatsoever up here.
There's a difference between book smart and street smart.
That like
It's,
she ain't, and my sister Katie knows this. She knows I love her. She's smart as shit when it comes to books. Like I told y'all, she's a social worker, so she rabbit, what the stuff she deals with. Then she
mm-hmm.
deals with campus, so she deals with a lot of sexual things like that. So, but
Mm-hmm.
she's smart. But when it comes to common sense, she ain't got not nan.
I know. Uh,
I
man.
don't understand what prompted or what scared that girl so bad to dump that baby in the trash can. You
Oh
was in the
man.
right place. All you had to do was give birth, hand that baby over if you didn't want it.
Exactly. Exactly.
True enough, our damn. Now let's not get into the foster care system. That's a whole nother thing in itself. But all you had to do was sign that baby on.
Yep. Adoption, something else, man. But hey, you know.
And no, I'm not a doctor, but everybody that was involved with this, they need to be sitting behind bars. Her going to prom, her being able to walk across stage, like hell no.
Mm-hmm.
Mm-mm.
Yeah.
She should have never been able to do that at all. She should have been sitting behind bars.
Yeah. Yeah. Oh my God, Chico. I'm gonna finish reading this, but so this is the page 3, by the way. Cause of death, entrapment, and matter of death, homicide. And Mom of Gladiator, she says, wait, again, Rabbit, yes, this came from the same TikToker who talked about the emails and didn't show them. So this is what she pulled, and she showed it out. We're gonna go through it, and y'all let me know what your thoughts are in the comments about it, okay? But thank you. Chico, you gonna stay up here with me, or are you gonna?
I'm actually finna drop down because I'm at work still, y'all.
All right. Don't get in trouble now. All right. Bye.
Bye, y'all.
Okay. So this is page 3. Hold up, y'all. Hold up. This is page 3 of 7. Remember, it's 7 pages. This is 3 of 7. So this is the recommendation that follows: cause of death, entrapment; matter of death, homicide. Let's go to page 4 of 7, and let me show you guys page 4 of 7. Here it is. 4 of 7. They did an external examination, general. Hold up, y'all. Zoom in, because I'm also a little bit blind and I refuse to get glasses. An autopsy is performed on the body identified as baby John Doe at the office of the medical investigator, state of New Mexico, on January 28th. So she had the baby on the 27th, and they did the autopsy on the 28th. The body is that of an infant male who has a weight of 2.54 kilograms, a crown heel length of 48, and a head circumference of 32 centimeters. The weight, length, and head circumference, and all of that is redacted. Encircling the left wrist is an identification band bearing Doe Baby John. The body that's cut off is received nude and accompanied by a torn plastic bag with paper towels and other trash. Personal effects are listed in the personal effects inventory. Post-mortem changes. The body is cool subsequent to refrigeration. Rigor is absent. Livor mortis is fixed, purple, distributed on the, I can't read that part, anterior posterior surface of the body, except in areas exposed to pressure. Examination. The head is normally formed. The scalp is black and short. The anterior, is it fontanel, is either depressed or bulged, bulging, are blue. The corneas are clear, and then other areas are white and clear. Y'all forgive me, I cannot read that. No hemorrhages are identified. Scaly conjunctives, facial skin or oral mucosa. The nose and ears are normally formed. The mouth blank, because it's cut off. The neck is unremarkable. The thorax is well developed and symmetrical. The abdomen is flat. The spinal is normally formed. The anus is unremarkable. The attached umbilical cord measures 63 centimeters in length. Okay, and grossly contain 3 vessels. The umbilical cord is normal appearance, and the placenta end appears torn. The placenta is not received for examination. Did y'all hear that? Okay. Thank you. Let me drop that. Let me drop it. Thank you. Sorry, y'all. I'm in the zone reading this. Here you go, Cape, if you want to hit that link. Please and thank you. If you can give me some go ahead and hit that link, and then just make sure you accept all of the the access to your microphone, and you don't have to show your face if you don't want to. We can definitely cover it. Yeah, so why no placenta? Look at that last sentence. It said their umbilical cord is normal appearance and the placental end appears torn. The placenta is not received for examination. The upper and lower extremities are well developed, symmetrical, without absence of digits. Palmar creases are unremarkable. The external genitalia are that of an infant male without abnormalities. This was a baby boy. Okay. Cape, I dropped the link for you, okay? She tore the cord, no placenta. Mother could have put that on. Yeah. Yeah, she wouldn't sit still. She wouldn't let anybody touch her. That's a good point, Amethyst. Thank you. I don't think that speaks to a real sound medical state. Hands and feet were normal, were general. Okay. Generals. Yes. Okay. So again, that last sentence I think is very telling. Their umbilical cord is normal appearance, and the placentile end appears torn. The placentile is not received for examination. Okay. Marks, scars, and cosmetics piercing. There are no readily apparent significant scars. There are no piercings, no tattoos, obviously medical intervention. There's no evidence of medical. Oh, there you go. No evidence of medical intervention. Keep that in mind. I will see that. I think at the very end we'll see that it was a perfect baby boy. I know devious, but some people were saying that some of those were I can't see you, love. You hit the link. You can't. I can't see you, love. You got to hit the link and accept it all. If you're using an iPhone, you have to use Safari. So you might have to copy and paste the link over to Safari. Yeah. All right. And let me evidence of injuries. There's no evidence of significant recent injuries. Okay. So this is page of 4 of 7. So now we got to head over to page whatchamacallit. Oh, I hear somebody in the line. Do you want to show your face or do you want to cover it? Hold up. Give me 1 second. Did you want to show your face or did you want to cover it, Tracy?
Can you hear me?
I can hear you. Can everybody
Okay,
hear
great.
Cape?
Hi, everybody. You can cover my face just to save everybody.
Well,
Sparing having me.
you're gonna have to, in order for you're gonna have
Oh,
to cover
do
it
I
on
have
your
to do
end.
that? Oh,
Yeah,
okay.
it should allow you on the bottom.
All right, let me see. Camera. Oh, yes. There we go. All
All right,
right.
and just know
I'm
your name
good.
is showing. Did you want your name to show on your
That's
thing?
fine.
Okay.
That's fine. I'm doxing myself. Everybody can know who I am.
Oh Lord. Thank you,
I am
guys.
you know what? I'm the Cape Breton drone pilot now, formerly a nurse. Had a
Yes.
spinal rupture there in 2017, but I'm still well versed in the art of nursing and post-op care and long-term care and all that great stuff. And I did a little stint in maternity. So what I'm
Oh
hearing
my
so
God.
far is that was about a 5.5 pound-ish, very viable, healthy baby. There was
Yes.
no abnormalities to this child congenitively, or anything like that. A computed topography is a CT scan, so they can
Thank you.
literally, yeah, they can literally go, like, if you can imagine looking from head to toe through a person's body, they can see a 3D image of all the internal organs and everything going on there, as opposed to just an X-ray that you can see bones. So they can
Right.
see all soft tissues, all organs. This child had oxygen in its lungs and its stomach. That indicates that it had breathed after it was born.
Mm-hmm.
The umbilical cord's been torn. It wasn't cut. It was torn. Placenta wasn't presented at the time. She may not have even delivered the placenta at that time because they didn't recover it. I remember in the video they were questioning, and that's why she would have been airlifted immediately
Yeah.
because of that issue, right? That she needs to deliver that placenta, and then they can deal with charges because that's a life-threatening situation. You can hemorrhage, like
Oh
right
my
then and
gosh.
there.
Is it
So that
possible to flush a placenta? Because they didn't find the placenta even at
no,
the hospital.
no, it's not possible unless she was able to tear it up with her hands. And I mean, I can understand if she was able to wrap an umbilical cord. Now, this is pretty gross, and I'm not trying to offend anybody or anything like that. I'm just saying, in the event of an emergency, and there's the old school way, right? I can
Yeah.
understand how she could wrap a cord around her hand and tear a cord, right? She's not going to be able to tear up a placenta. It's like a large kind of livery thing where
Mhm.
he's been, inhabiting for quite some time. So I suspect that she delivered him probably into the toilet or what have you, because it's easier to
Mhm.
sit down to push, or on the floor. Who knows? He came out. She probably tore the cord, put him right in the bag.
Oh my
He didn't
gosh.
have enough time to really. He wouldn't have been alive long because someone would have heard the infant make a noise, even from
Yeah.
outside the bathroom. The first cry of an infant's pretty loud when they first catch that breath of air, right? So I
Right.
suspect she was muffling that baby and stopping it from doing whatever she could to stop that child from taking that breath of air and starting to scream.
Yes.
Because when we birth our children, like within the first 1 minute, at 1 minute after the birth, 5 minutes after the birth, and 5 minute intervals after that, we do what's called an APGAR test on the infant. And you'll see the doctor, and he does it so quickly, you might not even realize what he's doing. But right after the baby's born, baby's under a warmer, under the lights,
Yes.
nurses are wiping off the vernix and everything off the baby, suctioning them out, clearing the airway, right? He picks the baby up, flips it around, runs his hands right from the top of the baby's head down the baby's spine, down his bum. And with that quick little assessment, he's actually looking at the
Yeah.
spine of the child, and he can tell if there's any pelvic problems, any cranial problems, neck problems, any of all the extremities are where they're supposed to be. Things are working. The child is anatomically correct, right?
Oh my
And
goodness.
it's a viable life if you get a good APCAR score at 1 minute of life. Like if the child takes a big deep breath and starts to cry, those are the indicators we're looking at right at the time of birth, right? To,
Yes.
to assess that child, to see what that child's needs are at the time of birth. So she's
Wow.
in there alone, right, doing this. And they're probably thinking, we got to get her out of there. But I mean, honestly, it makes me sick because I
Yes.
know a girl that did this. And that girl was a First Nations young teenage girl.
Yeah.
And I never did ask who the father was. I think I probably know, and it wouldn't have been anyone around her age.
Okay.
What she did was she went into the hospital. It was a very small little hospital, just like this. We call it a Band-Aid station because you can't really
Okay.
get through there. And very rural. She went in there, and right at the reception area where you go in to talk to the lady, there's a bathroom right there, right? We're in your waiting area. She
Yeah.
walked right into that bathroom. She delivered a baby, and she put the baby in the bin. Now, this garbage bin was a large bin receptacle that's in the wall, right?
Mhm.
So she just pushed the thing and dropped the baby in the bin and left. Someone heard a baby cry. And that's how this child was found. Now, this, I think, was 15 years old, I think she was when this happened.
Okay, so she was a
She
child
went out.
herself.
Yes, like
Okay.
young teenager, not 19 years old, knowing better. Not 19 years old, having a steady boyfriend and being a grown up enough woman to lie
Okay.
in the bed and get pregnant and have to hide it off, or and I
Yeah.
mean, I know people that have done this, but I don't know anyone at this girl's age and level of maturity where she should be that has done this.
Well, I hear you. It's and a lot of people are outraged. Miss Rowena, did you have something to add?
Hey, yeah,
I'm so
I'm
sorry
a
I kept going on and on like
No,
that.
you're
I'm just
fine.
really
You're fine. I
upset.
was like, I'm just
no,
I'm
that's
learning.
fine.
As a nurse, I'm telling you, I would have taken the door off the hinges
Okay.
long before. She wouldn't have been in there that long.
For sure. For
No,
sure.
no.
Oh my
No,
gosh.
I'm a labor and delivery and NICU nurse,
Are
Right,
and
you
you?
would have
Okay.
removed the door,
hmm
wouldn't you? Yeah.
I would have gone through the door. But
Yeah, you'd
the
take the door off.
talking
You
about
had
the
to.
placenta, and that's why I think it's going to be so interesting to see what this baby's blood volume is and
I
come
Mhm.
back
know,
for it
right?
because she didn't tie the cord. So it's just like I was talking
Exactly.
on another panel. You're talking about a baby that the cord was cut, and then the baby probably
Yeah, she didn't have
had a
clamps to
massive,
clamp a
massive.
cord and cut it. Yeah.
yeah, had a massive blood loss because the
Exactly.
cord was not,
So
the cord is
could
clamped twice. One cut, you know,
yeah,
two
so
That's
could
right.
the
clamps
When
cut in
when you have your
between,
baby, yeah, they got to
and
clamp it twice, and then the cut is done between those two clamps, right?
right,
Otherwise, you're
and
going to bleed,
okay,
the
right?
placenta,
so if you
the
tear the
placenta,
cord, go ahead. I'm
the,
sorry.
pla- the placenta is, if you think of it, the easiest way to think of it, it's an organ that keeps the baby alive. Okay, we call it an organ because
Yeah,
Mm-hmm.
it provides nutrients and oxygen to the baby. When
yeah, it
but
looks like a
what
big liver.
it's attached on the inside of the mom's uterus. So once that placenta comes out, even in a controlled delivery, it kind of, if you think of ripping a scab off of a sore, that's kind of what it leaves on the inside of the uterus. And the
And
Okay.
that's
placenta is
exact.
very much like it's just very tissuey. It doesn't take a lot that's why you never pull on a cord trying to get the placenta to release because you can
That,
snap that cord and then you have a bigger problem and you have bleeding out. So this mom,
yeah, that's
I,
why I was
I'm not gonna call her
surprised that
mom.
there
This
wasn't more
person,
blood on the floor.
the
I thought that there should have been more blood on the floor because, like, when I had my child, I
well, it
was
was on
mid
the
40s,
walls, and
and I hemorrhaged.
think it,
Like, what happened was, I delivered my child. It was regular delivery, but the doctor had to like give a little tug on the umbilical cord because my placenta was very low. We knew that, so I had a little issue delivering the placenta, and I ended up hemorrhaging. Right, so there's a lot
right,
of blood when that
and
placenta
it's called
detaches.
retained.
Yeah,
It's
Okay.
the reason why she had a DNC done. It's because it's called retained placenta. Even if you have a little bitty tiny piece of a placenta, your uterus will not clamp down. It will not stop bleeding,
exactly.
and you can
Yeah,
hemorrhage to death. So a lot of people are like, well, it wouldn't flush down the toilet. Yeah, it very well could have, especially if it was in pieces. And from what I've heard about the cord, I wouldn't expect it any other way.
Let
So
me I'm on page of 7. I'm going to finish reading this. Can
yeah,
I have you guys up here to give some thought about any other maybe there's a word that I
sure,
can't pronounce. Let me
yeah.
sure.
I'm just saying cuz this is like this
Hi, with my accent, you never know what you're gonna get.
well, that's fine. So it goes into general. There's no internal injuries or evidence of decomposition. Body cavity, no adhesions or abnormal collections of fluid are present in any of the body cavities. All
So he wasn't
organs.
stillborn,
Okay. So so those
right?
that were asking, well, maybe it was a stillborn.
No,
Okay. All body organs are present in the normal anatomical position. The central nervous system. Please refer to the separate neuropathology report for details on the central nervous system. The neck. Examinations of the soft tissue of the neck, including a strap muscle and large vessel, revealed no abnormalities. The blank bone and larynx are intact. The tongue is normal.
so she didn't choke him or
Okay.
like strangulate him, right? Because that would show indication of trauma to his neck. His neck was normal.
Okay.
He was
And
born a
then
healthy baby.
cardiovascular system. The heart is weighing 21.4 grams, and is it conical? I hope.
Conical. Yeah.
Okay. The pericardial sac is free of significant fluid or adhesions. The pericardial uh, surface are smooth and glycerine. The coronary arteries arise normal and follow the distribution of a right dominant pattern. There are no coronary artery. What is it? How do you say that word? I can't even say it.
Arterial thrombi. That just means that there's no like blood clots
Okay.
found in the arteries of the heart.
And plaque hemorrhages or dissections. The coronary, is it ossetia? Or
The coronary. What is it? The coronary
I can't see it. I'm sorry.
ostia. The
os?
coronary ostia
Thank
are
you.
patent and appropriately placed, so everything was normal.
Thank you. The heart valves are unremarkable. The myocardia cardium.
Unremarkable just means normal. There was nothing too abnormal about it to comment on.
Thank
So when
you.
you say unremarkable, it just means, oh, it's okay. Yeah, everything looks normal, basically.
Gotcha. So the
Yeah.
myocardium is dark, red-brown firm, free of focal origin or regional fibrosis. Can you read the rest?
So
Like I,
regional fibrosis, yeah, erythema,
thank
pallor,
you.
or softening. So in other words, a healthy heart, right?
Okay.
There
Yes.
was blood flow to the heart because it didn't have any pallor. It wasn't a paled heart. There's
Thank
no
you.
arrhythmia shown of the heart or any like softening of the heart tissue or the muscle. So it's
Thank you.
viable muscle, viable, healthy muscle, viable,
The
healthy heart.
Gotcha. The what is it? The
Ventricular septa are
mm-hmm,
intact. The septum and the free walls
are free.
are free and of muscular bulges. So no major cardiac event happened to this infant to
Gotcha.
cause any death. Everything's patent, so there's nothing clogging any of his cardiac valves, arteries. So it was not a cardiac death that he had.
So the
His left
chambers are not
ventricle,
dilated.
yeah, like everything is okay here. There's nothing like, if there was a trauma, let's say there's a trauma to a portion of his body, and he gets what's called a thrombus, which is like a blood clot, right in your
Mhm.
artery, right? So if that releases that thrombus, it's then and call it embolus or an emboli. It's traveling and it's going to go one of two places. It's going to go into your heart, pumped into your lung, and you're going to have a pulmonary embolism. And they can tell all of this by what's going on with your heart and lungs.
Mhm.
Or that blood clot's going to go towards your brain and you're going to have a stroke. So this child's not presenting with any indication that there was some trauma that would cause a blood clot that could release and get pushed into his heart or his lungs. He's healthy, you know, because
Wow.
sometimes trauma, if you do get a blood clot, it's a dangerous thing. Like that's why deep vein thrombosis, bad veins in your legs, are very serious business.
Gotcha. So in the
The
left
blood clot.
ventricle, go ahead. I'm sorry.
Yeah, so sorry, I got way off track there. So
The
so
left
they're
vent.
talking about like the parts of his heart, right? And
Yes.
as they describe his heart, his major branches, everything like that, this is all a normal heart. He
Okay.
has no coronary artery problems because he's a newborn, and he has no coronary defects either, like birth defects in his heart. Like
Okay.
his valves, his heart valves are good, the little mushroom valves.
Okay.
um when they talk about the pleural effusion and the stuff like that, that's just describing the actual, like they describe the myocardiac, so that it's myocardiac muscle. That's what heart is made out of, striated muscle, and it's actually covered with a covering over it and stuff
Okay.
like this. So they're saying like the surfaces are smooth, they're glistening, they're unremarkable. So there's nothing that's like torn through the bag that holds your heart, right?
Okay.
There's no trauma to the heart, no trauma to the sac that holds the heart, no fluid in between
Okay.
or frothy fluid or anything like that to indicate that there was like air pushing through his heart.
All right. So let me go ahead and finish
It all
the.
looks good. Sorry.
Oh,
Sorry.
you're fine. The left ventricle is 0.5 centimeters in thickness, and the right ventricle is 0.3 centimeters in thickness, as measured in 1 centimeter, and then her face is there. Um, Atrial ventricle valve. Is it alumnus? Is that how you say that? Oh, I don't know.
Yeah.
She. Okay.
Yep.
Go ahead.
I'm trying to say.
It
The
just went and buffered for a second there, but you're
Oh, I
good.
did.
Yeah.
Okay.
Yeah.
The ventricle spectrum is 0.5 centimeters in thickness. The aorta and its major branches arise normally and follow the usual course without, I don't know how to say that word. Y'all want me to zoom in?
Atherosclerosis.
Right. Where are you here?
Oh,
There
shoot.
with the
Atherosclerosis.
There it
There's
is.
no plaque. There's no plaque. Anything
oh
built up in.
yeah, atherosclerosis. Yeah.
Thank you. What does
No.
that
So
mean?
you're well. When you have high cholesterol, right?
Okay.
Plaque builds up in your arteries. That's what
Yes.
that is. That's when you got plaque build up in your arteries, right?
Gotcha.
Because it causes a thickening of the arterial wall.
So they're basically saying that there was nothing
Yeah, there's
of any of
nothing wrong
that.
with this child. It's a newborn child. It doesn't have cholesterol problems that cause them to have a cardiac event.
So the
It
vena
didn't
cava,
have a deformity of the heart in any way.
okay. The vena cava with its
Yeah.
majors, tributaries are patent and to the heart in usual distribution and are unremarkable.
Yeah, that just means that they were, the patent artery just means that there's nothing blocking it.
Gotcha.
You know what I mean? It's patent, right? So,
The respiratory system, the right and the left lung weighed 22.7 and 17.6 grams, respectively. The upper and lower airways are unconstructed. I think that's what it said.
unobstructed. Yeah.
Unobstructed, excuse me. That's
Yeah.
why it's kind of hard to read on because
So
they
there
have
was
a little
nothing in
heart.
his airway that could have impeded his breathing.
Yes.
Like any kind of
Nothing.
anything that could have got into his
Gotcha.
chest, right? Yeah. His
Yellow
airways are clear.
tan, musical, or musical,
That's the
mucosa,
yellow thing,
musical.
mucosal. Yeah.
Thank you. Do you want to read the rest on there
Yeah,
while
so
I?
the pleural surfaces are smooth, glistening, and remarkable pulmonary. Am I in the right place? Yeah, okay. The
Yes, you are.
pulmonary, yeah. Sorry, the pulmonary passages or something like that, I think.
The
Let me
palm,
just see if
it's pleural surfaces are
Pleura.
smooth.
Yeah, the
Thank you.
pleura. The pleural surfaces, okay. Exude minimum amounts of blood and frothy fluid. The pulmonary arteries. I can't see what that says.
The pulmonary dark red
Without
purple.
atheromas, that just means that everything was normal.
Okay.
His arteries have developed regularly. They're fully developed arteries of the heart. There's no impairments in the circulation of his heart.
There
So
is
his
no
heart would work regularly.
gotcha. There's no saddle embolism on
Yeah,
his.
no saddle embolus on his in situ examination.
Okay.
So that means there's no like blood clots or anything found within his heart that would have caused
Gotcha.
him to die.
Yeah.
Yeah.
Okay. And
So
then the liver weighs 97.9 grams.
yeah. And it's
The
smooth, glistening. It all sounds good to me.
right, what is it?
Well,
The heptech?
yeah,
Okay.
glistening tack. It's the hepatic castle, smooth, glistening tack. Yeah, the pair, and then covering moderately firm. Something it does note the perichina, which is fine. No mass lesions are noticed, so there's no tears or anything like that noted in anything. His gallbladder had some bile in it, watery bile, so his gallbladder was in function, basically. It's
Okay.
producing bile. The
The
mucosa of his
mucosa.
his mucosa. So like his mucous membranes,
Mhm.
basically, just look normal, right?
Oh,
So
wow.
no trauma there when you look at that. The extrahepatic biliary tree is patent without any evidence of calculi. So yeah, he had no problems with his kidney functions and stuff like that. It looks like everything was set up fine for his hepatic system, his kidneys, his
Gotcha.
urinary system, right? His gastrointestinal, so how's his belly, right? His gastrointestinal is lined with gray, white, smooth mucosa. That's normal.
Okay.
Um, the mucosa is autolyzed and the lumen, I can't read, 3 milliliters. Okay, so that's how much volume was in his belly.
Gotcha.
And then can you scroll up a little bit there?
Yeah. I
Thank
think
you.
well, hold up. I don't know if it'll let me scroll up. You mean scroll to
Come
the side?
on. Yeah, like I'm on my phone and I don't know what direction I should be turning my phone to be looking at the screen, but it has some green bound, like everything is normal here.
Okay.
Basically, they go through every system and they're looking at every major portion of each system,
So the
vital portion.
the stomach was looking pretty
Yeah,
normal.
the stomach was empty, right? But
Yeah.
he didn't have anything obstructing, like, so he never swallowed anything and choked. Nothing went into his throat that ended up getting into his belly. It's normal for him to present this way.
Yeah.
And there's no lesions to any of the sounds like intestines, the duodenum. Like you have a small intestine that feeds to a large intestine, eventually it gets to your bowel. They're literally going from the stomach, and they're going all the way through that every little bit, and they're not finding any tears, any malformations, like anything wrong with him.
Layla,
Okay.
there was never an attempt for them to revive him. That's my even this report says that. I don't think that there
I
wasn't
think
a
he went in the bag pretty fast, and she spent
trauma
some time
too.
trying to clean it up.
Yes.
Yeah, I don't think that there was any way to save that baby.
That's what they're saying, right? All
Yeah.
right, so let me go to
Yeah.
page 6 of
As
uh
heartbreaking as that is, because she was left alone with it, right?
yes.
So
We're going to go to
I've got to hop
I
down. Thanks for having me
Thank
up.
you.
So
I'm sorry I
y'all
talked too
have a
much.
great day. No, you're
No, you're
fine. Bye bye.
fine. You're fine. Let me see if I could pull up image of what is it? 6 of 7. Here it is. Hold up, y'all. Here it is. I appreciate you. Listen, I'm no medical expert. I'm like reading this and I'm like, what the hell is this? Okay, here is um
The reproductive system, his prostate gland and all that.
it's still going on the kidneys on that top page. Do you
Oh,
see that?
sorry, yeah. Yeah,
Okay.
let me see if I can get the cortices are normal thickness. So he was normally formed,
Okay.
well delineated from the medullary pyramid. So he was like comparatively to his body, his spine, and where his kidneys and everything are. Everything is in the correct place. There's
Yeah.
no calluses, problems with his pelvis. Everything seems to be in alignment there, in pelvic alignment. His
Mhm.
ureter, which was the way he would pee, right, is non-dilated and free of stones. So he doesn't have, obviously, he doesn't have any kidney stones. This is a
Yeah.
newborn baby, right? But the ureter, the tract to allow him to void was free and clear, so there are no obstructions there. His urinary bladder contained no urine. He never got a chance to probably make any yet.
Yeah.
And the bladder mucosa is gray, tan, and smooth. And that's how things would normally present to them as far as internal, visceral and internal linings of a lot of the organs would be very gray and smooth and shiny, right?
Yes.
That's how they present.
Let me know if you need
So,
me to scroll down.
yeah. And then, so no urine. The reproductive system, his prostate gland, seminal vessels are infantile, so newborn. His
Mhm.
testicular, so he's a boy,
Yes.
and he's a healthy boy. Nothing remarkable there. So normal look, no abnormalities. His spleen, like this sounds like it's just a typical 5.5 pound newborn.
Pretty
It's really
much.
heartbreaking. It's heartbreaking. It really is.
Oh man.
Um, his spleen is normal, intact capsule covering red purple. So he has no he never had an injury to the spleen or anything like that would cause him to internal bleeding and death.
Mhm.
Like no trauma like that. Bone marrow from his rib, they tested, is red purple. That's normal. Mesenteric lymph nodes are prominent, but not unusual. So that means the lymph nodes in that particular area were a little bit big, but nothing unusual.
Okay.
And his thymus is unremarkable. Yeah. All right.
Wow. Oh my gosh.
Unremarkable. You see this over and over and over and over, right? And it just
Yes.
basically means there's no injury to note. It's intact. It looks as it should be. Yeah, there's nothing to remark about, basically.
Right.
So,
Oh my god. And then here's a question. Let me mom
yeah,
of a gladiator says, "Rabbit, there was no what is it? Anatomic? Is that how you say it?
yeah, anatomic. Yeah, anatomic.
Fluid
That
or
just means
anything like that. No, there wasn't any fluid or anything like that
nope,
in his airways.
nope.
It was literally whatever was obstructing him from breathing, which would have been the bag.
Ex-
Yes, nurse Bev,
exactly.
no
Yeah,
abnormalities.
yep,
Absolutely.
yep. His airway basically was patent, like open. So like
Mhm.
like if you have a hose and you kink your hose, right?
Yes.
Your hose isn't patent anymore. Nothing can pass through, right?
Right.
That's what patent is, right? So patent means a clear tube, a clear airway, or a clear vein, right? It's all tubes, right? So
Right.
patent means that there's nothing obstruction. There's no obstructing it. So it's free
Wow.
and clear. The bony framework, well, he's just little, right? I think that he's 5.5 pounds because she was trying to hide this pregnancy. Therefore, she took the diet pills. Therefore, she had the small baby. Maybe she even tried the smoking technique too. I know women that smoke, so they could have small infants because they don't want to push out big babies at childbirth. It's really a twisted kind of thing, but it's really weird. But I think she was taking the diet pills to kind of help her hide what she was doing here.
Yes. Well,
And
and I
that's
mean, it
why she has a
clearly it
five and a half
affected his
pound
growth.
baby at full term,
So
right?
it affected his growth,
His
right?
growth, yes, of
Oh
course.
my God.
She's limiting her weight. I mean, I know another girl like long ago. Hello, long ago, and this would have been like in the late 80s, and
Mm-hmm.
she strapped her stomach and didn't
Oh
tell
my
anybody
gosh.
she was pregnant. She was 18, but her boyfriend was 16. And his parents actually drove the ambulance. So they picked her up and took her to the hospital. And on the way to the hospital, she had to tell them, I'm not having kidney stones. I'm having your son's baby.
Oh Jesus. Okay.
Yeah, talk about a bad scene because at 2 o'clock in the morning, when they finally got home, they woke up their son, who's 16 years old, and said, Get up and you're a dad.
Oh my
She
God.
hadn't told anybody. Yeah.
Yes.
Now, can
Thank you,
you imagine
Rowena.
now that scenario? So you don't know, like people do weird things, like I say all the time, right? Some people don't handle situations as well as we would hope they would,
For sure.
but they
What?
don't go to this, right? This
No,
is
I
an
agree.
extreme. This is extremely unusual, beyond unusual. Sorry,
So
Layla's speaking now.
so review of the postmortem what is it? The sonography
Yeah,
scan reveals overlapping sutures, aerated lungs, and in the air, stomach, significant natural disease or acute skeletal trauma is identified. What does that mean?
it means that through the CAT scan, they could look at all the soft tissues, organs, and bones, and there was nothing broken or disturbed on him.
Okay.
He was okay. The scans are revealing overlapping sutures. Well, that's normal. Aerated lungs. So there was air in the child's lungs. There was air in his stomach. So clearly he was breathing on his
Yeah.
own accord, right? And, that wouldn't happen otherwise. And
Oh my gosh.
no significant natural disease or any kind of skeletal trauma. Like, he wasn't dropped and had a head fracture. He wasn't, I don't know, like had a rib puncture an organ, like things like that. Trauma
Okay.
that could cause a death, right?
Gotcha. So
There's
then
nothing that does. No.
in these
He's,
kinds of reports, when you have is it histology, they list the
yeah,
umbilical cord, small
colon
intestine.
appendix, yeah,
So
everything.
they're listing all the organs basically, right?
That's everything that they sent for histology testing. Yeah.
Gotcha.
Yeah.
Is
And
there
they do it
anything
all. There's
is
nothing in that that's
uh-huh.
it's all unremarkable. There's nothing wrong in there. There's nothing. Nothing.
Let me go to page
It's
7.
it's crushing because they have to go through each system, right? And determine if there's anything that could have caused an event that could eventually cause death, right? Even if it's not something that could instantaneously cause death. And each system they're going through, they're not finding anything that would cause this infant to die.
Wow. And here are all
Yeah.
the organs again, guys. What is this
And he was
fluid
able to
analysis?
breathe. They know he took a breath. He
Yes.
took breath on his own. Now, probably not a lot. She's probably quite weak. This is a very small child. This is a traumatic birth. There's nothing there assisting.
No, the
And
here, Lisa, the
yeah.
diet pills didn't kill this baby. This baby was born alive. This baby was not stillborn.
No, it's a live
It was
birth
a live
baby.
birth.
And then she quickly probably put it in that bag. Make sure that nobody's going to hear that baby cry.
Yeah, it was a live birth. It wasn't a
She had
diet
no
pill
intention
murder.
of that child living, or she would have opened the door at any point in time. And that's what's so disturbing. Like,
So,
the girl
yeah,
I know that just dumped the baby and walked out, she got in the car, and her mom said, "What did the doctor say?" "Oh, he said I have an infection." And then she's driving out of the yard, and her mom notices that she's starting to bleed, right? "Why are you
yeah,
bleeding?" "Well, you turn the car around and drug her back in there, only to find out, oh, yeah, there's a baby in the garbage can." So to hear that this happened again is
yeah.
like, oh my God, are you kidding me? This really does
My
happen.
goodness. What are these fluids right here? What is all this?
That's just all the fluids that are in okay, so the thymus, the thyroid, the trachea, his esophagus, his throat, right?
Uh-huh.
His airway. So they're looking for basically anything that could obstruct his airway.
Yeah.
If he had vernix, anything like that, what? They got a suction out of a baby's mouth right after they're
Right.
born to give them a
Right.
to help them have a patent airway to breathe better. And there's nothing here that's gonna block his airway. And then they check his stomach, his testes, his prostate, his bladder,
Yeah.
and there's no abnormalities, like no significant abnormalities. And it's just over and over again the same thing. Vitreous fluid, right? They can take fluid like from your liver, right?
Okay.
They'll draw fluid from your liver and other vitreous fluid tissues, and then they go and take that fluid and they test it for cultures to find out if there's any bacteria or anything else that could have caused an infant's death, like a
Yeah.
sepsis or anything like that could have interfered with the development of the child, right? If there was a problem with the placenta or an infection with the mother and what have you.
Yes.
So that's all.
Gotcha.
Okay. Bacteria, heart, blood. There's no bacteria in his blood, so he's not septic. He didn't have any blood condition or any pathogens in his bloodstream to indicate that he had any form of infection. It's
Mhm.
sad. It's really sad.
Cheryl, we are not giving educational opinions. We are just giving commentary. If you're coming here to get I can't even read half of these medical terms.
I'm just a nurse, and I'm just trying to read a
He's
document and
helping me read
interpret
through
it with
this.
my knowledge, my limited knowledge. That's all.
Yeah, so please
Yeah.
please go somewhere else with that. Thank you for trolling. Um Let me see, and there is no toxicology report that was included in this. Let me go to the first page real quick and show you.
That's a separate report that they'll
That's
get
gonna be
from
a separate report.
toxicology. Yeah.
So, like, would the diet pill come up there as well?
Yes, it will be in toxicology. Yeah. It
Wow.
will be in the toxicology report. That's where it's going to come up. So if
Right.
they find that in the infant's, oh, well, then they'll know that she was taking it long enough for her to metabolize it and to get into the infant's system as well.
Thank
Right?
you.
So
Yeah. Yeah, and Cheryl, by the way, it's your opinion, but we're not giving medical information. We're just commentating
I'm
to what
just
this report.
speculating on what I believe took
Thank
place
you.
here. Yeah.
So you're coming in here, you're not trolling, you're saying, but you're coming in here with such vitriol in your comment. Like, I need you to step back and look at the fact that nobody's taking medical advice from us. This is complete commentary. Thank you.
Yeah,
Um,
absolutely. I'm not a doctor, and I don't play one on TV either.
or on YouTube.
Yeah, or on YouTube, right? So,
Thank you.
no,
And this
I'm
is
just a nurse, but I have experience in labor and delivery. I know the things that are looked for, and this is all standard. This is a regular autopsy. It's very thorough. It's exactly the way it's supposed to be. Nothing is standing out in this as of yet.
exactly.
Nothing.
Exactly. So
No.
this is pretty, I guess, entrapment. That's what the final diagnosis of this
Yes.
situation is, right?
Exactly. And the reason why they come to this diagnosis is because of the presentation of this person that they're doing the
Right.
autopsy on. This person was presented, right? And it's on record that it was found. I say it, and I don't mean to. I mean to say he, because it really upsets me that his name is what it is after his mother, and I just think that's just so sad. So we'll just say he, baby boy.
Mhm.
Um, yeah, baby boy, John Doe, as they say, would have died from entrapment. And they know this for a fact because there's no abnormalities of his body,
Mhm.
of his bodily functions, of his bodily system, and there's no trauma shown to his organs, his brain, right?
Mhm.
Or anything that could cause an instant death of a child, right? So, like, she didn't like drop him on the floor, and then he died. Something like that, right? Because there's
Yes.
lots of ways there's lots of things that can interfere and cause death, especially in a young child and a newborn. But it's not that. It's not that. They have not found any trauma to the infant that they can remark in the autopsy. So it's sad. So they know he was presented.
Mhm.
Um, the bag was with him, right, at autopsy.
Mhm.
So they know he was entrapped in the bag, and they know that the bag was tied.
Yeah.
They understand that there's a limited oxygen supply for that baby available if it's in a confined, tied off space. That is what an
Absolutely.
entrapment is.
And they even defined it,
Yeah,
I think, mid down there. Entrapment occurs when an individual is in an airtight or relatively airtight container, in this case, a tied plastic
exactly.
trash bag, and
Yeah,
consumes all of the available oxygen until there's no longer enough oxygen to sustain life. Given the
that's right.
investigative information and the examination findings, the cause of manner of death are best certified as they called it entrapment and homicide. Um,
Exactly. Exactly. You hear the word entrapment oftentimes at motor vehicle events. You have a person you have an entrapment, they'll say, right? That means
mhm.
the person's actually trapped in a vehicle in a life-threatening situation, and they need out of there. It's a life-threatening, you know what I mean? This is the thing, right? You're not going to sustain a viable life in that situation. It's an emergency. You need to out.
This is an interesting
So
point, and this is true crime. Thank you,
she
True
put
Crime
him
Time.
somewhere he can't get out. He's a newborn baby. He can't get out of a bag.
Cape, what do you think of this? Because True Crime Time said he had adrenal hemorrhage. There was trauma. Is that caused because of the entrapment on B?
It could be. It could be. It could just
Gotcha.
be due to death, right?
Yes. Yes.
Because I mean, like if she would have, let's say an infant falls, right? There
Yes.
could be trauma, bone trauma, musculoskeletal trauma. They'll see bruises, they'll see marks, there'll be broken things,
Yes.
right? There'll be something that caused this chain effect that eventually ended into the end result is the death of the person.
Yeah.
But there's nothing here. Like even his, so she didn't, common cause of death. What's common? Blunt force trauma. There's no blunt force trauma, right? Strangulation. She didn't strangle him.
Yeah.
He hasn't been shot. He hasn't been stabbed. So he has no blunt force injuries. He has no sharp force injuries, right?
Yeah.
So I mean, you gotta consider, like, what are his injuries? Well, he couldn't breathe.
You know what is really tripping me out though, and I think this is probably a lot of the chat is I think I don't want to speak for everybody, but what is I'm going to show you guys the first page of it. What is really
I'm not
tripping me
saying the
out.
child would, like, all I'm saying is the child should have been in a situation where there should have been some intervention,
Yeah.
right?
Yeah.
Because without it, this is the outcome.
No, but
Right?
what is tripping me out is this whole umbilical cord thing. Like
Yeah.
it's
Well, I don't think she'd have a clamp. What's she going to clamp the cord with?
thank you, Allie
When you
Joe.
deliver your child, there's two clamps, right? They
Yes.
clamp the cord, and then they let daddy come with the scissors, and it's his honor as proud daddy to cut that cord, right? It's already clamped because that's blood flow. That's how the oxygen goes to the baby. Everything goes to the baby through the umbilical cord, and is very vascular. A lot of blood and like, you know, a lot, because it's basically a big vein, really, when you think about it, right? It's life support.
Gotcha.
So they clamp that, right? That's clamped. If she went and took that and tore it, how's she tying it off? It needs to be tied off
Oh,
somehow.
but where did this
Or she's
placenta
gonna.
go?
That's why I keep thinking, like, it's so weird, right? Because I keep watching the video and she's walking out of the bathroom, right?
Like
And I see
nothing.
the doctor looking down at the floor, and I'm
Yeah.
thinking, how come there's not more blood? But then I'm thinking, maybe she didn't deliver the placenta yet. Because, like I say, when I only had one baby, and I was like 30 some years old, first kick at the can. And I remember they told me I had low placenta, blah, 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 blah. So I delivered my son, and then it was time to deliver that. And then I hemorrhaged after. And I remember the two nurses pushing really hard on my belly to push the blood into my belly to get my uterus to start contracting.
I
And it was a
remember.
big racket. Like, it was a big racket in there, right? And a fish tub full of blood. It was pretty disgusting.
Gotcha.
But so I keep thinking, like, man, did she get to deliver the placenta? Would she know to do that?
Right. Well, that's
Would
what I'm
she
saying.
know
It's
to
like,
do
how
that?
would you know to do that? Or did that just
I
kind of
don't see
come
how she
off?
would know to do that unless she already did a little research on what's going to happen when you have
They
a
never found
baby.
it. Right, but they
Yeah.
never listen, somebody said that I hope that they pull out her Google searches. I'm kind of in that point too.
Oh,
It's
they
like,
need to.
because
Oh,
I'm
they need to, yeah. Well, basically, they don't really, you know what? They just need to charge her. They just need to charge her, because either way, that is a major crime. She ended a life. It's as simple as that is. And just because you're young and naive and, you know, young, because we were all there. We were all that age. We all did stupid stuff. We all made bad decisions. But this decision was a catastrophic one, and it ended a life. She needs to be charged. She needs to be
yeah.
charged.
Yeah.
It's just that if she was 19 years old, went out and drunk driving and killed your mother in the next car, she would need to be charged. You see what I mean?
Yeah. So I mean,
It
they're
doesn't
gonna do
matter.
something.
Like, yeah, like she's either going to end up in a jail or in a mental health facility, because obviously she's scared of her mother. You're 19 years old. That's the thing. That's that we protect our kids and, you know, and my babies, but your babies are 18 or 19 and your babies are having babies. And if you think about it, when you think about your grandparents were younger than they were, having their families, and they were not adult enough to take care of their kids. You know what I mean? You can't really judge. And I know 16-year-old mothers that are exceptional mothers. Absolutely exceptional mothers. They're just all about their kids. So it's not about I'm young and I didn't know better. It's just you're in denial. This is a mental health situation. And if it's, you know, but it's not criminally responsible mental health
Right.
situation. It's not like that.
Yes.
You know,
Right.
it's
No,
mental health and it's also criminal.
yes. My
So,
goodness. This is a lot. So what
she
we
just
know
had
is,
to open the doors. All she had to do,
yeah,
because it doesn't matter how afraid of her mother she is. The staff is there to protect her from her mother.
that's true.
That's the thing. She had all the protection in the world around her, and she had people questioning her. Mother shouldn't even been anywhere near her. You know,
They
don't question her anywhere near her mother, first of all,
right.
because you're not going to talk with the mother in the room.
Elizabeth, they did arrest her, but she's out on bond right now.
Because
She
her mother treats her like she's a young 14-year-old, 13-year-old innocent little girl that didn't know any better. And of course she is, because it's her daughter. And if it was your
emasceration.
daughter, you'd be like, oh my God, I don't know what she was thinking. She would, you know, her mother even questioned her, obviously, because right in the body cam, you could hear her mother saying, you know what's her name, Alexa, or whatever her name. Anyway, she said, "What I told you," like, you know what I mean? Like they
Yeah.
already had that conversation. She had denied that she was pregnant.
She was on birth
Yeah,
control.
we talked about this. That's what she said. We
Yeah.
talked about this, or something like, you know, that kind of comment. Like the mother already had this conversation with her.
So
So
emaceration is not chewed through. That's not what that
no,
means.
maceration's like, you know, if you put a band-aid on your finger and you forget about it for like a day and a half, and then you pull it off and the skin underneath is really white and wrinkly and soft, right?
Yeah.
That's macerated. Just like if you got in the tub too long and you come out and look like a California raisin, that's macerated. Macerated means hypersaturated, basically with fluid, water, right? So
Mhm.
your skin has taken in too much water. Now you've impaired your skin barrier, right? Because your skin
Yes.
is your biggest organ of the body.
Yes.
And
Exactly.
if you disrupt that barrier, bacteria can get in. So that's why it's not good to put a dressing on and leave it there too long without cleaning it up and changing it. Because you could get bacteria and wetness and it can cause a bad infection, right?
Do you think, I know you know your experience, you know, you're just
I keep
commentating.
forgetting we're on. I keep thinking I'm talking to Rabbit like down the road that I.
Which you are. We just got like 300 some people in the chat. Shout out to you
No, I
guys.
mean, I'm
But
sorry to everybody. I apologize to everybody. I
nah,
don't
you're
get any social
uh-uh.
time.
Stop. You
And
like I
I'm
couldn't
ranting
even
and
read
raving
some of
because
these
I'm
words.
excited to be here.
No, I couldn't even read some of these words, and Miss Rowena here too. But I have a question for you and Miss Rowena who's in the chat.
Yeah.
My question, what do you think about, do you
Yeah, I
feel
can't
like,
see chat, so yeah. Sorry,
yes,
go ahead.
okay. Do you feel like the hospital staff is here liable? Miss Rowena, if you can answer the same question here in the chat, but like, do you hold some liability to the hospital staff? Because I'm
Yep.
with Bubble Pixie here too.
Yeah, I think so, but it's really hard though, because if she's not forthcoming with it,
Yes.
right? As a nurse and stuff, you cannot be forceful with the patient either, right?
Yes.
So liability as far as the hospital is concerned would be very limited, right?
Mm-hmm.
Because as long as they treated her and asked the questions they needed to ask, if she wasn't being for where they screwed up is letting her be in that bathroom alone that length of time. That's where they screwed up right there, you know. But other than that, and I
Yes,
mean, she wasn't in a room. It's not like she was. So that's how it's gonna go. Like
for sure.
she's waiting to be assessed by the physician. She's in a regular, like, you know, emergency area or whatever. The bathroom is right there. It's right there, right outside the nurse station. The nurse's station is right there.
For sure. Oh man. All right, Miss Rowena, what do you think? Tell me your thoughts.
Oh, okay, this is a hard one. It's easy to
She's
sit back
cagey,
on
wasn't
Monday
she?
morning and
Hold
I
on.
can't
say,
believe she pulled it off.
what, what I would have done. I, I know I don't think that the hospital staff is responsible as this uh person. I'm not calling her a mom. She wasn't. I no, I don't. I do hope that things change. We had changed the protocol at my hospital years back to where it used to be like mom, dad, grandma, neighbors, everybody came back there and we asked patients all these questions. Well, then we got to where I'm going to ask you about domestic violence in front of your significant other. No, no, no. So
Exactly.
we made everybody wait out in the waiting room. We asked mom the questions where she could freely open, and that's where I think the kid. That's that. Yes, I can honestly say no. I cannot see myself walking away from that trash can without snatching that baby up. And I've been a charge nurse for many, 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 many years. And the reason why you're a charge nurse is because you delegate duties. Okay, I'm gonna be
Exactly.
resuscitating this baby. You go get the doctor. How about that?
Ex-
So, but
exactly.
the first where this institution failed was when she first walked in, and there was by staff that there was a heated discussion whether she was pregnant or not. And to me, I think that those questions should have been asked in private of her. She's an adult. and she can answer for herself. And I don't believe that she gets a pass on. She was a preemie. She's 19th as a junior. I don't care. I'm not trying to sound heartless or whatever, but I don't care. I don't. Then what? Every baby that's born premature, we're going to give them a pass that you can do whatever to your children in the future? No,
Mhm.
sister. No.
That
Can I see
that's
myself
exactly
walking down
right.
that hallway and leaving that baby in that trash can? No, I can't. Have I had patients that, no, I haven't had a patient that delivered in a bathroom. Well, yeah, I have had a patient deliver in a bathroom. We knew she was pregnant. But, I mean, I've had the opposite.
Because
I had a patient show up, came in by ambulance, bleeding with twins. She wasn't friggin' pregnant.
Yeah.
And I
I'm
said
still
it as she
shocked that it could
rolled
happen
by.
even twice.
And
Yeah.
when I went, and I had to do a police report down the ER because we had to get her off our floor. You know, you don't lie
Wow.
about having not one baby, but two babies, and you're going to steal our babies? No, you need to go. You figure your stuff out somewhere else, but not here, not around our babies. So, I really hope that the protocol has changed to where initially, when this person was first, when, when when it was we made the patient that wasn't pregnant, we sent everybody to the ER. They thought they had to fill out paper from the ER because she came in by ambulance. We can lie. I can lie to your family members all day because I'm gonna
Yes.
protect her rights. So that's what we did. We got a blood test. And I'm talking about, look, the dad, he married her because she was pregnant with twins. I mean, this was an elaborate this wasn't this one patient. I've had the preacher's baby, the miracle baby of the church. Yeah, it wasn't his baby. It was and it was a stillborn baby, but it wasn't his. It was the choir director's. So I've pretty
Wow.
much seen it all, been it all, touched it all, smelled it all, done it all, and I
All
don't
the
give this mom a pass. And but I'm not going to sit here and I wasn't in charge that night. I wasn't
Mhm.
that that nurse's nurse. I don't know if they were doing CPR and trauma one too. I don't know. We don't know what was going on. We don't know. But I'm not going to sit here and say, well, they hold us just as much responsibility. No, they don't.
Mhm.
no,
No, they don't. Would I have
they
done
didn't.
things different? Yes. Do I hope protocols change? Yes. But where I hope that they change is from step one, sentence one, to where it is stated that, bam, this is the questions I'm going to ask you, and then we're going to go from there. And
Thank
any
you.
needed discussion, you can take it on in the weight room with the family mama. There you go.
Well,
That's the
and I
way I roll. Sorry.
no, you're fine, Miss Rowena and Kate, because I ask you because you guys are have that medical hat. I don't. You know what I'm saying? I'm just a little person over
She
here.
is 100% right, because when it comes to family, you can't just assume that who's like blood relation is family and all that.
No.
There's a lot of families that are estranged, like blood families that are
Okay.
estranged. The only person that you're actually allowed to speak to in regards to a patient is their authorized next of kin.
Right.
Like, for
Right.
example, if you were my authorized next of kin, anyone in my family could call. The nurse is not going to give them any information. They're going to say, call her next of kin, Rabbit, and speak to Rabbit.
Kate, let
Right?
me hold
Like,
you right
that's
here.
how it goes.
Let me hold you right here because I have Lady Justice. Lady Justice, what do you think about this whole? You have that legal. And again, this is all commentary. We're not giving legal or medical advice over here. Just so
Yeah,
everybody
I don't
knows.
know. I can't really give legal advice. I don't know enough. I've seen bits and pieces of this, but unfortunately, um, I've seen probably more of this in my real world than I have on YouTube. So something that I just want to say is I hear, I think these are nurses that are on your panel
Yes.
Yeah.
is, and I hear people talking and how things happen. So on the legal end, I can say this. And I can say it from firsthand experience for myself. And actually, I have a sister that now does this. That's a RN for 35 years. And
Mm-hmm.
what happens when these things are happening in hospitals is there's checks and balances that are in place. Most emergency rooms, and this was a small hospital, from what I understand, couldn't even handle the after birth delivery. But most especially the large university and research hospitals, but I have smaller ones that have the same thing. There's a risk tree analysis is what it's called, or decision-making tree. And most emergency rooms in the larger hospitals have these right there. And I have seen them with a family member be used. And what it does is it's a checklist that they're required. Everybody, the CNAs, the RN, the doctors, they go in and they have to actually sign off on it. And it puts you through some of these steps, like the mom, being pregnant, saying she's not with her mom in the room. And there was, at least I got enough out of it, an adverse, we don't even have to know the mother-daughter relationship enough to know that you could observe that was off and that mom should have been removed.
Oh, that I was
from the
shocked
room.
that she was there.
Yeah.
I couldn't believe that they would ask her in front of her mother. That's unheard. That's no. You don't.
Yeah, even
That's
with
not
my own
normal
children.
practice for nursing. No.
Yeah. Even with my own children before they were 18.
We're trained to
they were in the
separate you to
age
ask
where,
those questions.
yeah,
It's
where
just
they
like an
can get
abuse
into
victim.
drugs or alcohol,
Yeah.
right? They separate. The other part, though, that's really significant that people should be in tune with is not only do you separate, but they are separating now adults from what she was, minor, right on the edge of being a minor. And in my mind, you're 19, you're a minor still. But the fact of the matter is they are separating now those situations and trained to separate, even when it looks like mom and dad, because of human trafficking being so high, you guys.
Exactly. That's
And
why
so,
you
like,
always have to separate, because you don't
yeah.
know what kind of influence that person may have on your patient.
Yeah. And so I've, done it where
It's
I've actually
essential.
been on the human trafficking training end in my state with some senators, and was actually in the hospital when they were showing us how it was done. And then I was on the mom end of it when I had a child with a sports injury, and they were asking me, who are you? Who is this lady? Does she know? Like, they asked a bunch of questions, and they were human trafficking screening questions. But the point is, there's a risk tree to avoid this. I don't care if you're pregnant, if you you can have just and ladies, it's just a disability that you're a fall risk. She was a fall risk if she was given medication. She never should have been allowed to get off that bed and
That's
walk
right.
anywhere by herself. Now, there's a
That's right.
misconception that people kind of, if you haven't been in a lot of hospitals, good for you, but all hospitals, the rooms in the triage room, which is what she was kind of in, they don't have bathrooms. The bathrooms are in the hall. And it
And
appeared,
you're
right, that this
walked to
was,
the bathroom and
yeah,
assisted to the bathroom. You're
and they
not
stand
left
right
on your
there
own
with
going.
you. Right. And they stand right
Exactly.
there with you. So when something like this happens, where there's a major mishap, what'll happen is it'll go to legal. And we like this, by the way, as lawyers, and medical malpractice lawyers, especially, because you're for, yeah, of course, they're in it for the money, but they're also in it to prevent, right, and to deter. So whenever there's a case at these larger hospitals, what happens is it goes to, it's called different things, different places, but basically risk management. Okay. And
Yeah.
then risk management, and it's usually, like, my sister's an RN, and she's like the top of a large hospital doing this. What they do is they look at all the notes, they do all the interviews. It's a huge protracted thing in large institutions, especially when there's a death. So they go through and they figure everything out. Then they will meet with the family pre-litigation, before they file, and say, obviously the situation's a little bit different, but this, and this happened, and this is what we're going to do to prevent this from happening again. And most people that sue just don't want it to happen to somebody else. So that analysis on this, and people say they hope it changes, I guarantee you that this hospital doesn't have anything in place, because it was a failure at all levels, including the doctor looking in the bathroom and walking back out.
Yeah, that was crazy.
So it's a really unfortunate thing, but I wanted to just say that, because people that have family members, I mean, it could be your mom that's in her 70s and she's over medicated, not by her own fault, but by just being prescribed something that was too heavy. She could get up and fall. Well, you don't want to have that, you know, so we want to know that we can also be a part of the solution, and that they do actively look at solutions. And it's really weird that in 33 years I got to watch this go full circle, where we are all, the medical professionals, the doctors, everybody is working together for solutions. So even when they do the risk management with the nurses, they'll call in special, you know, the doctors that were actually, whoever had their hands, you know, involved in the case. But then they will also call their experts in their chairs in their department to come up
Mm-hmm.
with an addition or a tweaking of that risk tree. And we always say that there's always room for improvement. So you can always
Yes.
be tweaking an
And
existing system.
You got that
and
right.
risk management is not going to wait 3 months like the detective. I can guarantee you that that next day, risk management was there talking to
Oh,
the
I bet you
family
I'll
risk
and met
management
with them
was,
several times because I
Yeah.
had to go through it.
well, I've
I'll
had it
bet you
where,
they were all floored from this, because this is an unprecedented situation. They've never seen anything like this happen before in this little hospital. This is the same kind of a
well,
little Band-Aid
and
style
why are we
hospital that,
outraged? Why are we
yeah,
outraged?
like,
We're
like,
outraged
it's
because it was
ridiculous.
so preventable,
Yes.
so
Yep.
preventable.
Yeah, they don't even have the ability to, do anything labor and delivery with her at that location. It's well, I live in a village that we have like maybe 800 people here. It's very
Yeah.
tiny. It's like a Smurf village. It's ridiculous. And we have to travel a half hour to go to our little local hospital. And you know what? At this point in time, it's not staffed by a physician. We can't find a doctor to be at our hospital. It's not technically a hospital. It's a Band-Aid station now, and they're not even allowed to do an EKG there.
Well,
You know,
keep this
Not
in mind.
believable.
I was just with a client. I have an
But I'm in
85-year-old
Canada. So.
with a traumatic brain injury, and I've had her for 10 years. She's
Mhm.
kind of my side family, my adopted grandma. But in any event, she, within the last month, been in the hospital twice. She was discharged, patient dumped on a Friday at 3:30. I should have refused. I should have refused, but I took her, and then took her home on a Friday, and then took her back on a Monday. But the point being is we have to kind of remember, with nurses and medical professionals, let's give them some grace, because everybody nationwide is got a shortage going on. And
Oh,
what
Yep.
that
God, yes.
also means is we have people doing jobs that aren't trained to be doing the jobs that they're doing. So it's a perfect storm, if you will.
Yes.
I
And it's just
agree.
so
And the
unfortunate.
frontline workers are working so hard, and they're
It's a
spread so
lot.
thin across everywhere. It's really difficult, right,
Well,
to make it all work.
keep in mind this too. This happened on January 27th. In the interviews, the detectives did the interviews. What was it? The week of the April 25th.
Oh,
So when you said Lady
what?
Justice about yes, they so the baby was born. It's not a stillborn,
Yep.
nothing like that. The baby was born on the 27th. They did the autopsy January 27th. They did the autopsy on the 28th.
Yep.
And then um they actually interviewed all staff involved, which, by the way, I saw
Mm-hmm.
that court papers were released where all these witnesses, nothing but medical staff or the witnesses, all these people that did interviews, was until April. I think the first interview was April 25th, and then it went on to like the 28th, where they interviewed everybody. So perfect opportunity for stories to change, memory to lapse, risk management to be all over the place,
Well,
because yeah, it was weird.
yeah, that is really strange. So like, was that law enforcement was in obviously right away, but um what I have seen is, and I'm talking in the middle of the night, and I can remember one time being during vacation period, that my sister got, called, is they're out, depending on what it is, right away and right on the scene. I don't understand why, um like, if internally the hospital is going to get on it, why law enforcement, why was the investigation so long? But I think probably some of that answer is because they're getting, all kinds of information and tips, and oh, she said this or that, you know what I mean, where they're just, buttoning up loose ends, because there's nothing between January, I mean, the day within 24 hours of this happening, an autopsy and everything. I mean, basically, it's the baby was born alive, took a breath. And so, what your charge is. And so the rest of the investigation is basically building the case. And I don't understand why why it would go over
Well,
such a long period. It's just weird. And the
Yeah,
girl is still
yeah,
out, right?
and she was out on bond. I
Yeah.
think she had her hearing, I want to say, what, shortly after her arrest, okay? And then she was released on bond. She was allowed to go on to prom. She didn't walk. I believe she was supposed to graduate. She didn't walk. The father of the child did. And he was identified in the body cam footage with police. She had been on
Yeah.
birth control for 2 years, but denied having sex, right? So, and of course, we take birth control for all kinds of things. It's not always,
Yeah. A
not to
lot of
get pregnant.
girls at that age
Yes,
take it for their skin
exactly,
or
or
acne.
menstrual issues or whatnot.
Yep. Yep. And didn't wait, let me interrupt you real quick. And didn't this girl have oh shoot, endometriosis?
I don't know
I
about
don't
that
remember
one.
seeing that.
I never
Okay,
heard that.
listen for that, because I heard that somewhere, and because the only reason I know that for sure I heard it, and it was on a channel like yours, like Rabbit, where I would have believed whatever whoever was giving the facts. But if she did have endometriosis, that would explain, like, people are like, well, you would know that you weren't, you were missing your period or whatever. But
Yes.
you got
Yeah,
nurses on
there's lots of
panel.
good reasons that you can miss your period, though. There's other reasons
Well,
why. It could be like dietary
exactly.
reasons and
She
many
was a
reasons why.
cheerleader. You know what I'm
Yeah,
saying?
She
Like,
was a cheerleader that was pregnant, that was starving herself because she was gaining weight, and she was hoping that she wasn't pregnant, that can stop your
yeah.
period. But there's, if she had the endometriosis, it just adds a different twist in terms of the mom and the mom being involved. And there's something really weird, and I shouldn't say this, but since this is
Say
my
it.
entertainment time, not my legal time, is there's something like was really off to me about the mom in the
She's
ER.
afraid of her mother. She is so afraid of her
No, but
mother.
what about the mom, this piece, the mom saying, um, I told you, we talked about this. Like, we
yes.
Yes,
talked about people throwing babies out, and then she just shut up. It was just
Well,
exactly.
really
hold up.
weird.
Well, this is what
Yep, it was
happened.
crazy.
She
It
said,
was the
I
Let's
told you to
craziest
tell
comment.
me the truth.
This is what happened. A couple weeks ago, there was a same incident in New Mexico of a girl by the name of Alexis
Right.
who did the same thing. So she was court. I think she was, when mom was saying, I told you about this also, but you know what happened to the girl who threw her baby in the trash, you know that? And I'm not really familiar with that case. The other thing too is Follow the Grain says, no, she was born with spinal cord issues. Mom on the body cam footage said that, she was born with like her
Okay.
spine, Lexi's spine.
Yeah. Yeah. I heard that too.
My question is she talked about going to a chiropractor before going to the hospital. If Lexi was a cheerleader and she was doing all kinds of physical stuff, right?
Mm-hmm.
And they had chiropractors, that they would go to, how many other medical, if possible, would we know how many other medical eyes have been had on her and didn't really detect that she was pregnant?
Oh, I
Well,
think a lot of people questioned her and she's just denied it.
Well, and I think it's natural also at that age for girls to gain weight, as they're fully coming in, beyond puberty, when they're juniors and seniors in high school. I kind of think that you see that. But I'm going to say this, and it is bizarre, and it's the absolute, truth. I went to high school with a girl, and it was a conservative little, Christian high school, where if you got pregnant when I went to school, is you got sent away, sent away across the country to, go live with an aunt or something
Oh
for a
my
year.
God, you must be my age.
Yeah. So,
We're the
so what
same age, I
happens
think.
is, this girl that I went to school with, and she played basketball. She was a year younger than I was. And you guys, she graduated from high school. She was, a waitress at the country club. And she delivered a baby the afternoon after, like, we saw her serving everybody earlier that day. And you could not tell she was pregnant. I mean, at all. And she was, she wasn't a tiny, tiny girl, but she wasn't huge either. And did she have a period? Did she miss a period? Did she, whatever? She delivered the baby and kept it. But I'm just saying. And then there's
Yeah.
another girl that was 3 years younger. I have a lot of sisters that's friends with my sisters, that obviously she was obvious she was pregnant and she knew, but the reaction, even in the two girls and how they acted and carried on their life. I don't know how that one that was pregnant worked right up until she delivered. You guys, we could not tell. You could not tell. And she went in for like a stomach ache or something and then delivered a baby.
Wow.
So,
That
I
happened
do
to me
think it's
over.
possible. And I also want to say this, as we're all women and we're judging, it's really easy. I mean, we know right and wrong, and we hope that we teach our children right or wrong and those we encounter. But the fact of the
Yes.
matter is, we are not in this girl's shoes with her parents, with her environment, with all the way she was raised, with,
True.
all of the life that she's gone through, all short 18, 19 years of it. Like, to judge what she did, how she did it, when she did it, would we have done it? No, it's easy to say hindsight's 2020, but it's really hard. And I always check myself on this. It's really hard to say what we would do if we were in
Exactly.
a situation. We would
I have a
hope we wouldn't do it. And
I
it's a
have a
good time to
teenage.
talk to our daughters and to our, granddaughters and people that we know. But I just, I want her to learn from her very grave mistake, and, to still have some life ahead that she can do some good. Now, that's not for me to decide, though. That's for
But
the
Lady
justice system.
Justice, daughters and sons, because to me, even that piece that it's like, wait a minute, y'all are sexually active, and you have to give some education to your son as well, right?
Oh yeah.
Um,
Actually, I have all sisters and one brother. I have 8 sisters and one brother, and so so we can talk about a lot of this. But I
yes,
have girls and a boy, 3 girls and a boy, and I have a sister that has 3 boys, and she's an educator, a high school, trained, whatever. I guess they're high school counselors. I let all my kids talk to my sister because she's just straight up with them, and the boys part is really serious. Like, even the boys in my state, they're changing it to, if you have someone has had a drink of any kind of alcohol or taken any kind of mind altering substance, you can't say, yeah, you can't consent to sex.
right.
So that now means that, our 18, 19, 20, 21 college age kids that are in college doing what they do in college has sex with somebody, and it's a strict liability. Now you're going to get charged, and I don't agree with that. But I just think that having a conversation with our boys, young men and women, it's always a good time to talk, and it's a good time to tell these kids, because I think it's been out there long enough that we don't really talk about it as much anymore. But the safe stations and safe drops, I mean, this girl was in the hospital. How can we figure out what a safe drop is? But you know what I'm saying is,
Yes.
there's other answers. And I do think the mom, and you nurses on the panel can vouch for this. I can't imagine. I've been in as an attorney, I've had family members in the same room, and the nice thing with attorney client, I gotta excuse whoever else is in the room, right? But I've been in some of those weird situations with moms or dads where, like, you need to have them leave the room.
Oh yeah,
Yep.
because the lawyer-client privilege does not accommodate the bystander in the room, right?
Yes.
No, right. But I'm just saying, like,
Yeah.
you could just tell, like, that there's a strain somehow in that relationship. And I just wonder if they would have removed the mom, right?
Yes.
Or if they would have escorted her to the bathroom, it would have been
Yes.
a different story. That this
A
poor girl
chance.
thought having a baby and being
It,
pregnant at 19 was the end of the world. Well,
Yeah.
somebody could have changed that whole outcome.
She
that's
might
why I
have been
wonder if
just afraid to disappoint her mother. She might have been the perfect child with the good grades and never got in trouble in her life. I had a cousin that was like that.
Well,
He
let
was
me.
top of the class, everything, got himself in trouble, too afraid to tell his parents. He shot himself. He killed
Oh my
himself.
and
God, Miss
Yeah.
the
Miss
So,
Rowena, what were you gonna add? I'm sorry.
um, the and that's, and Lady Justice, I can't agree more. And that's where I wish at the very beginning, when they questioned her, if she could have built some form of trust, she might have pulled that cord for help. You know what I
yeah.
mean?
Yes.
If she could have had that, and trust can come in a blink of an eye. And I did it all the time. I mean, I used to do it with my patients where it's like, I know it's really hard for you to ask your mother-in-law to leave, but we're probably going to be laboring about 12 hours. And if you want her to go, I would come up with, like, say Oreo or squeeze my hand or whatever. To where that way I cleared the room. I did it in a nice way. And then,
That's
Yes.
right. A
because it's
safe
really hard to
word.
look up and say, you need to go. I want to take a nap. You need to go. So, so if she would have just had that brief, I can trust that one nurse. If I pull that cord, this one nurse will come.
Yes.
You know, she won't tell my mom. That's what I go back to, is that first interaction. I think
Yes.
if
Yeah.
that trust could have been built, and if they can go with and change things to 2023, because we've been doing it for years, to where people will. I mean, it got to where, I mean, we had to ask patients like, you know, did you have running water? Did you have this? Did you have that? Because
Wow.
we're sending a baby home with you, and I don't know you, so I'm not going to assume anything, you know, and so that's where the breakdown to me, and I really hope that that one step that
Yes.
for every patient, I don't care male, female, yeah, I don't every and patients have rights. There's 5 rights that patients have, and
Yes.
as a nurse, I would have had to protect her rights. But
Oh,
also,
yes.
there's 2 patients in that bed. There was the baby, and there was her, and
For
that baby
sure.
also had rights too. So that's just kind of where I stand on it. I just what I wasn't there. I don't know what was going on the floor
Yeah.
at that time. So I can't say, you know, but
Let
I
me
don't
ask
think
you
I could
this.
live with myself.
As
All people need to have
nurses,
a place that's a safe place for them to land. You
as
know, when things
nurses,
happen that you don't expect and you don't know how to handle these things, there should be some, like, I wish there was some way to facilitate some kind of a movement that would let kids understand that there's always a safe place to go, right? To reach out.
well, I wonder
There's people that care, right?
that this was
That will protect you.
a cheerleader, and cheerleaders tend to have their own little tribe, and that usually
Oh
includes
yeah.
the coaches. I kind of wonder what the dynamics were there, and I find it hard to believe that there weren't some discussions, because that's just what happens at this age in high school. But as nurses, I'm wondering, just to hear your perspective, like, it is a different challenge in today's world, and it's not the COVID challenge where we can only have 2 people in the room. But what would make it easier for you in these situations where you have an adult with a child, that's of age? And here's the other little click I want to add: is I can't find out. My children are tested at their annual exams, and it started when they were 16, probably, right? They're tested for STDs.
Yeah.
And I, as the mother, and as the one that brings them there also, and as the one whose insurance they're running this through, when those results come back, they can't tell me. You heard me. And I'm the one that's going to be expected to take them and get treatment and whatever. So, like, what I'm getting at is that there's a lot of challenges in our healthcare system that kind of have this intertwining of parents, and they can be with children until they're 25, 26 on their insurance. So what can be done to make this easier, to make that demarcation line so that the patient is actually getting the care regardless of who's paying for it or bringing you there? Does that make
Excellent point. Excellent point. Because you don't know. It could be, what if it wasn't a person that was victimized for some reason, and the person that's bringing them there might be a parent or something, could be the offender.
Yeah.
You, we don't know, right? That's why it's imperative to have, for them allowed to the patient to have that opportunity to have a private discussion with the nurse without the parents feeling like they're being isolated, or parental alienation or anything like that, like somebody's trying to talk to their kid without them being there. You know,
Ladies,
it's a fine line, right? It's a dance.
ladies, I'm gonna have to head out here pretty soon because I have baby bunny over here. But I'm gonna let you, Cape, if you can answer the question. That way we can
I'm sorry.
conclude. No,
Yeah.
you're fine. And I just,
What is
first
the
of all,
question? Yeah.
it was a huge loaded. It was a good question, number one. But go ahead, Lady Justice, if you could summarize the question.
is what
I'm
can we
sorry.
do with policies and procedures, because we've seen a swing from where you're at COVID, and we could keep, not that it's, and you could regulate the number of people that were in a room, and you could ask people to leave because of infection, and now we're like back to somewhat normal. And we're dealing with people that are on your, can be on your parents' life or health insurance till they're 26, 25, 26. And how, what would make it easier to make the line of demarcation of giving the actual patient the care and listening to the patient? And I'm not suggesting that nobody did, but to have that one-on-one with the patient, um, with a clear line of demarcation on care versus the parent? Do you bring them in, like in the situation with the emergency room? I mean, if you bring in the kid and you isolate the parent, I mean, it might not be appropriate, may or may not. I'm just wondering if there is a solution, and I'm curious to hear what you think would be helpful.
Yeah, I think that we got to look at the legality of things as well, right? And because as the patient, they have a right to their own privacy and confidentiality, right?
Right.
And
Exactly.
even though you have a parent in the room, it doesn't mean that they have the right to have that information. So it's a fine dance and a delicate dance, and I think a lot of it probably would come down to a lot of liability and legality
I think
around
it
it.
would be,
Because you
I think
can't parentally alienate the parent. They have to be present if it's a minor.
well,
They
if they
need to
have
be
to
present.
consent, but I think that there's a certain amount of that because the lines aren't the same, and that's what I'm getting at. Before, it was all the parent that consented to everything and we didn't really, even like when I was growing up, they didn't really, the
Yeah, you
parents were
didn't even
always,
have any rights. Yeah.
where now, and with whether it's human trafficking, having, sex, experimenting with, or going to a party and just being warned, hey, don't take a cup from a stranger. We live
Yeah.
kind of in a different world where you really need to have that one-on-one time as a medical provider without the parent there
I'd love to
to
see
ask
it
the
something
questions.
adapted within the schools, like a
Um,
safe program within the schools where they could go right at ground level, talk to all the kids, and say, "Listen,
yes.
Well,
there is a safe place that it's
yeah, and I try not to
confidential.
be
It's got nothing to do with your parents."
Ladies, I have to drop.
critical, but you got to
I'm
believe
sorry.
that there was a teacher or a school counselor, and they serve in that function. Maybe not the teacher because the lines are very distinguished now in education, but the
Yes.
school counselor or the dean of students or somebody like couldn't have done a little bit of their own investigation in
For sure.
Yeah,
questioning or
I
taking the
wish.
squirrel under their wing. It's just weird.
It
But I'm
I'm
is.
gonna
sorry,
let you go,
Rabbit.
Rabbit. I appreciate you letting me up on panel.
Thank you,
Thank you,
guys.
Rabbit.
Thank
Kisses for
you.
Baby Bunny, both
Yeah.
sides of her
She's
cheeks.
giving me the dirty look, so I'm like, I'm
Oh,
coming.
she's
I'm
like,
Well,
coming.
baby bunny
get
ate
rid
all
of
my
them, Mom.
begonias. Bunny ate all my begonias, so she's
Oh,
probably got a tummy ache.
y'all are funny. All right. Well, thank you
Have a
guys for
great
coming up.
day.
Have a great
Thank
one. Thank
you.
you. Thank you. Thank you. So thank you to Cape, Miss Rowena, Chico was up, as well as who else was up? Cape was up. What else? What else? There's a couple of people up. Now, before I head out, there's a couple of things I want to say. SW said, thank you for the $4.99. She said, with only a 4-pound baby, is there any chance that she was only 7 months along and they still call that a full term? I think the baby was about 5 pounds, if I remember correctly. I don't know about that. I thought anything over 34 weeks was full term. That's my understanding of it. I could be wrong, but thank you for that. Okay, the other thing too I want to say before we head out, I was sent this information. So we have a on this case specifically for those that are going to be following it. There's a pretrial hearing September 11th of 2023. The judge is Jane Schuler Gray. Okay, and it is the county courtroom 1 at 9 a.m. There's a jury trial scheduled October 2nd at 9 a.m. So keep that in mind. I don't know if they'll allow for streaming. I don't know if it's going to be totally, thank you so much, Keels, if it's going to be on air or anything like that, but we'll be following up. The other thing, too, all right, baby bunny, I'm coming. Here's the other thing, too. I had a lot of people hit me up, and I'm going to be very, I'm going to say this. I have people that have been hitting me up on this case because they have information and whatnot. If you're involved in this case, if you're having to testify, first of all, nobody should be paying for any information if you're somehow legally involved in this, right? So note that if you're telling me that you're about to drop me information, if I pay you, I don't pay for sources and I don't pay for interviews. Okay? Just so you guys know. You guys have a great one. I have to head out. Okay, mama. I'm out of here. Bye, guys.